Vicki. I work at the Wake Forest location at Synergy. I am a medical esthetician, laser technician, and I just appreciate you coming today to listen to me talk about Sofwave. So when it comes to Sofwave, one of the really nice things about it is you can actually do it any time of the year. Sofwave is ultrasound, so it's not looking for any kind of pigment, which is sometimes why we can't end up doing lasers during the summertime, is because the laser is looking for that pigment. Sofwave is actually just ultrasound, so it's going deep past the pigmented areas to help stimulate that collagen and the elastin. So the nice thing is you can kind of jump right in and get a treatment any time of the year, summer, winter, and not have to worry about any kind of sun exposure when it comes to doing the treatment. I love using Sofwave and pair it with lots of different other treatments. The nice thing about it is we work really closely with our injectors. A lot of times I will talk to somebody about Sofwave, and then I'll also have them go in and meet with one of the injectors to kind of talk about different things that might be beneficial, because we want the Sofwave to last as much as possible. So being able to do things like Botox or Dysport or Xeomin to help make that Sofwave last a little bit longer. And then our injectors a lot of times will ask us, let's do a Sofwave, and we'll stimulate as much collagen and elastin as we can, and then we can kind of clean it up a little bit with maybe some fillers to kind of soften those additional lines that we want to treat. When it comes to how many treatments does a person need to do when it comes to Sofwave, a lot of times I just tell my clients it's about your own expectations. Some people, they have a little bit more that they needed that little extra lift. They might have a little bit more necklines that they want to focus on. So sometimes just doing one treatment just isn't enough. So normally I will tell people, let's do one treatment and then have you come back for a follow-up to take a look to see if maybe we might need to do a second treatment. Everybody's expectations are very different. And so when it comes to Sofwave and what you want out of it, sometimes you might have to do a second one. It does normally take 3 or 4 months for your body to kind of build up that collagen, the elastin. So it's not an instant gratification like you would get when it comes to fillers, but it's a nice, natural, soft lift and tighten and softening of those lines. But it does take 3 or 4 months. It will continue to stimulate that collagen and elastin for up to 6 months. And most people feel like the lasting of the Sofwave is good for a good year. So a lot of people will end up coming in to kind of maintain that Sofwave look once a year. Having that good expectation is, I just want a little bit of tightening. I just want a little bit of lift to kind of make myself feel better and feel more rested. Sofwave's a great opportunity to help get you where you want to be. So when it comes to Sofwave, we obviously want to see your progression and see how your skin is improving. So we always end up taking a bunch of different pictures, making sure we get all the right angles for your skin. And then usually within a couple of months, we'll have you come back in, we'll do some follow-up pictures just so we can visually see how the skin has actually improved. DEJ Boosting Serum is a great anti-aging serum that is going to help stimulate that collagen and elastin. It is also amazing for anybody that has any kind of redness in the skin. It is also amazing for texture overall, just in general. When I've used it, I just feel like my texture has just improved a lot, helps with those fine lines and wrinkles. So you just want to make sure that if you're going to go ahead and do a treatment, that you've got a at-home regimen that is going to really help support what we did here. If you're interested in Sofwave, we'd love to see you. All you need to do is give us a call, set up a consultation, and we'll go over all of the things that you need to be ready for when it comes to doing Sofwave. Thank you so much for joining me to talk about Sofwave, our ultrasound energy-based treatment for stimulating collagen and elastin. And next is Shelby to talk about Sculptra.
Hey, I'm Shelby. I am the nurse injector at our Wake Forest Synergy location. And today I'm going to talk a little bit about Sculptra and how we can use Sculptra to lift and restore the overall face and provide some facial rejuvenation. So to begin this segment, I always tell patients that through the aging process, we have a progressive loss in the structural integrity of our skin. This is from both intrinsic factors, that is the natural aging process, as well as the extrinsic factors, that's going to be your UV radiation, UV damage and air pollution. As this process happens, we lose a set amount of our collagen and elastin each year, as well as we reabsorb quite a bit of our bone integrity through the year. So as we lose this collagen and elastin, you'll definitely start to notice different changes in the skin, such as fine lines, wrinkles, sagging, loss of elasticity in the skin, an overall just change in the texture, or patients will start to notice feeling a little bit thinner. Usually this process begins in the mid-30s and if not the 40s, and a combination of all these different factors, as well as losing a good amount of our bone density, will further accelerate this process, and you'll start to notice definitely aging happening in the skin. So I will then kind of speak about Sculptra and how we can use this to not only provide subtle volume rejuvenation, but it will also really help better the skin quality and act very preventively as well. One fact I always like to reference with my patients is that starting in the mid-20s, we lose about 1% of a collagen in our skin each year. Collagen is the structural protein that makes up the skin. So this is a very important just overall with the aging process of the skin. So by the time you're in the mid-40s, we typically see a loss of about 25% of that collagen from our baseline. So when I'm looking at a face, I typically like to address a face from top to bottom, as we have our triangle of youth in the mid-20s, where I always say highest and widest points of the face are these zygoma bones, and as everything kind of comes down to that mentalis, gets thinner. Again, as we age, this triangle of youth tends to flip, where we start to kind of see this heaviness in the lower face, can be shown with marionette lines, nasolabial folds, things of that nature. So again, I still definitely will kind of tailor the treatment regimen to what your specific needs are. Often I will start with a dermal filler to kind of give that structural integrity that is often going to be used to mimic your bone structure, to kind of help lift and support the underlying soft tissues, facial fat pads, bone. And then Sculptra, I typically recommend, again, where you can kind of use it all over the face. So if somebody has volume loss generally throughout the entire face, that is a great treatment for that. Oftentimes I will do both, use kind of in my toolbox those dermal fillers and biostimulators like Sculptra. And again, anytime you're working to better that skin quality overall, you're going to get the best results. So again, Sculptra is just wonderful for patients who are just noticing more crepiness to the skin, more thinness, more elasticity loss. Just, it's a really beautiful product to kind of maintain that firmness. It gives you a really beautiful glow, which is one of my favorite things about it. And it's a very natural, beautiful result where nobody will necessarily know you had anything done at all. You will just be looking a little bit more refreshed, skin just healthier. Skin is more radiant and glowy. Another question that patients, often ask is this, again, a replacement for our traditional dermal fillers or neurotoxin? And my answer to that is definitely no. Again, I will like to bring my patients in. We will do a full comprehensive facial analysis. I'll look at your skin. We will talk about the aging process, and I like to tailor and use all three of these different types of injectables in my treatment plan. Again, I really always tell patients that Sculptra is going to provide more gradual volume and going to just better the skin quality, where if we're really needing some structural integrity and support of the underlying facial fat pads, I often will turn to my Juvederm dermal fillers. A big fan of, Voluma, Volux, things of those nature. And obviously for very specific areas like lips or tear trough, that's going to be a different type of dermal filler than what we would be using in the mid-face for that structural integrity. And then another thing I did want to mention is, I know we do have a segment on Skin Vive coming up. Skin Vive is another beautiful product that I love to utilize in my patients. I know it's a little bit confusing with all of these different injectables now, but Skin Vive is going to be just a skin hydrator. So it'll just help hydrate the skin from within, give you you, a very nice glow. It's wonderful for those colder winter months, or if you have an event coming up and you just want, that dewy, glowy, hydrated look. And then Sculptra obviously, is going to kind of give you that glow. Sculptra, I would say, is going to take longer to see those benefits, but Sculptra, the difference is really we are focusing on building and creating that collagen and elastin, which is just so important to overall skin quality and just preventative nature of that skin. If you are interested in the lifting and restoring benefits of Sculptra, I would love to have you in for a full face assessment and consultation. I can answer any questions that you have. If you want to just learn more about Sculptra and the benefits of this, we'll kind of go over your individual treatment history, medical history, areas of concern, and work to tailor the best treatment plan for you. Thank you so much for tuning in and listening to my little bit about Sculptra. I really love this product. It's really, really exciting, and I look forward to meeting you as well.